Hello and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and our business line leader for our medical and laboratory businesses at Intertek. And today I'm so thrilled to be joined by my guest, Samir Ahmed. Hi, Samir. Thanks for joining us.
Hi, Clarissa. Thanks for having me.
Yes, wonderful to have you. So I love to always have my guests maybe give just a little bit of a background on yourself, an introduction to who you are, what you do, what you're passionate about, and then we'll dive into our topics for today.
Thank you, Clarissa. I'm Global Vice President and Head of Sales for Intertek's assurance businesses. I lead our global commercial strategy for our auditing, certification, regulatory assurance, as well as our sustainability advisory businesses. Overall, I have completed my 9 years with Intertek now, and overall, I bring in total experience of around 2 decades today. Have worked in different geographies. Currently in Europe, I'm based here in London, but have exposure to Middle East and Pakistan market. I have mainly worked in the areas of risk management, quality assurance, compliance, as well as supply chain services. Currently, a big part of my focus today in the current role is helping organizations, our customers, navigate complex supply chains while balancing speed, quality, compliance requirements, as well as sustainability expectations of their stakeholders, especially in the highly regulated industries like medical devices.
Yeah, absolutely. So obviously you have quite a varied background. And, when we're thinking about some of these things, especially with supply chains and everything that's been going on from a global perspective, right? I think we've seen a lot of global disruptions, right? Everyone, of course, is familiar. We went through the pandemic. We're still feeling the effects of that. There's a lot of, geopolitical tensions that we're seeing. There's a lot of supply chain issues overall. So when you think about this overall and these kind of recent disruptions that we've seen as an industry, yes, definitely not specific to medical, but when we look at, how it's reshaped supply chains, what these changes mean, are these changes here to stay, right? I mean, we're going through a unique time that we've never seen before. So from your perspective, obviously, again, having been in this business for a long time and having touched a lot of different things, how do you see how this, has changed and if this is likely going to be our future?
Good. I appreciate the way you framed this question, giving a context to pandemic and how the 5 years have spent after that. Look, global disruptions have forced medical device supply chains to rethink how they operate. During pandemic, if we recall, we all saw shortages of critical components. We saw border delays. We saw urgent demand spikes for essential devices. But then post-pandemic also, we have seen geopolitical problems. We have seen ports, some major ports in the world getting complete shutdown. Mm-hmm. There were delays for shipping routes. And we've seen raw material constraints also. So the pressure was always there. Companies have to respond quickly to the disruptions. And what has changed in these years is, if we look back 4 or 5 years, companies have responded to disruptions in a situation where they were having limited visibility and completely unpredictable lead times. What we are seeing now is more structural shift, moving from just in time to resilience by design. We are seeing manufacturers are diversifying sourcing. We are seeing they are building regional capacity. We have also witnessed industry investing in digital monitoring tools to track critical components more closely. Mm-hmm. At Intertek, we have supported medical device companies through this shift, whether it's qualifying new suppliers or providing business continuity through our ISO 22301 audits to assess resilience across the supply chain. And in short, I should say that resilience, agility, and transparency are no longer optional for the supply chain. They are now foundational to how supply chains operate.
Yeah, and I think this idea of resilience by design is fantastic, right? And when you look at, okay, yes, there of course were some pain points and some major hurdles that the industry went through, but as you're saying, now that we see, okay, people are being more prepared, right? You're having alternate source suppliers, you're having digital tools, you're thinking more about this, in future planning. There is a lot of benefit, I think, that came from that. Although, of course, it was a very challenging time going through pandemic, post-pandemic,
Yeah.
and now everything that we see now. There are some of these things, as you're mentioning, right? When you look at the overall supply chain, then it's like, oh, things have gotten much better or improved in some instances.
Great. And I was saying the supply chains, the pressure on supply chains didn't go down. And now recently with tariffs, we are all experiencing the impact of tariffs on the supply chain, the way
Mm-hmm.
the shift is happening. So yeah, and the industry is continuously evolving. And you're right, resilience is taking the center stage.
Yeah, and I think it's important to think too, right? I mean, we see medical devices are getting more complex. The industry itself is getting more complex. Testing, inspection, everything, it's all evolving, right? And when you
Yeah.
think about the supply chain assurance portion of that, right? It's becoming increasingly complex as well. Even, take away some of these global disruptions. We're just talking devices are more complex, supply chains are more complex, access to components and how things are shipped is more complex, right? So
Yeah.
are you seeing things about, our role that are different or how people are approaching their supply chain assurance differently in the medical space?
So if we come to medical space and precisely talking of medical devices, we all know that medical devices are not just hardware. Today,
True.
they are often connected, software driven, and also we are seeing they are made of novel materials. So this adds to the complexity of both performing validation and ensuring there's a right level of risk management in place. So third-party assurance is becoming more integrated across the product lifecycle of medical devices. Again, bringing Intertek's experience, we're not just, and I'm sure you lead that process. So we are not just testing finished devices. We're also supporting raw material assessments. We are supporting regulatory strategy planning. And we have seen growing demand for early stage technical due diligence right at the upstream of the supply chain. And also then having end-to-end quality oversight, especially for companies which are scaling up into their operations or they're entering new markets. So third-party companies like us are acting as partners with companies to enable faster, safer, compliant, and sustainable supply chains.
Yeah, and I think, you make such a good point because I think there's been maybe this misconception in the industry or people have thought for a long time that they have to handle all of this on their own, right? So you're responsible for your supply chain, you're responsible
Yeah.
for qualifying all of your suppliers, knowing where everything comes from. And when you talk about this, support from early engagement and raw component all the way through, right? Raw materials to components to end product, right? I think, there is this idea that, oh, as a manufacturer, we should be handling all of these pieces, but the idea that you can partner with someone externally to really help you go through that process, especially as it's getting more complex. And now, we have such a complex regulatory framework for medical devices, right? Of course, with the FDA requirements, with MDR, there's just so much that a med device manufacturer is thinking of in the day to day that it's like some of these things, like your supply chain, can be outsourced in some way or partnered in some way where you're getting support to make that process a lot easier.
Yeah. And you see the word we are using over here is partner, not a service provider. And when in any customer organization, we usually, when we talk to them, we say that, look, don't consider us as your service providers, because in that case, our relationship remains very transactional. But when we are working in a partnership approach, then we, value each other's contribution, and we also value uh, how to respond to each other. And then, there are classic examples in place today where organizations work with third parties as their partners from the beginning, and they have seen massive value addition to the process. So yeah, I think we are super aligned over here and really want us to position third party companies as partners in this entire process.
Yeah, and I think, the partnership approach is how we always view, anything we're doing with medical device manufacturers. I think it's such a great way to look at it. We know it's
Yeah.
complex, we know it's not easy, and so we always want to be that, partner to them. I did mention a little bit, we talked about the frameworks that we're seeing from a regulatory side and things that are getting more complex, right? So the MDR obviously introduced a few years ago, really a big change for medical device manufacturers, super
Hmm.
complex with post-market surveillance, super complex with understanding, how your product exists from beginning to end. Same thing with the FDA. So are you seeing things there related to the regulatory requirements from the MDR, from the FDA as it relates to, supply chain agility or compliance or end of life, right? Are there things that you're seeing that are directly coming from some of those regulatory requirements or regulatory frameworks?
Of course, these frameworks which you just mentioned, I mean, they have all raised the bar, particularly around traceability. There are stringent requirements for documentation as well as post-market responsibilities. So these regulations and frameworks have added pressure on supplier qualification as well as ensuring that manufacturers maintain the ongoing oversight on their entire supply chain. And again, I'll bring the example of how we are helping clients in this process. So Intertek helps companies in the MDR conformity assessment, gap analysis, and also technical file reviews. We are seeing strong interest in integrated QMS, quality management system solution, that meets both ISO 13485 as well as MD-SAP requirements. So companies that are thriving under this highly regulated environment and are able to survive strongly under these frameworks are those that have built agility into their compliance process. And they are the ones who are able to leverage digital tools in this process. And the one word which is commonly used in this industry is maintaining audit ready systems. This is super important for them, that you don't have to prepare for an audit. Your day-to-day work is audit ready. And of course, working with companies like Intertek, who can understand the entire landscape of regulations as well as the scale of global challenges. So yeah, I think the frameworks have impacted significantly. And there are so many examples today where the companies have taken them as a reason to drive change in the organization and have created a system around it so that they remain audit ready and they are always compliant no matter what stage of the supply chain it is and at what scale of the service delivery they are.
Yeah, and I think this phrase, raising the bar and thinking about how this has changed just the mindset of the industry, right? Again, it's not just as simple as, hey, we put our product on the market, now it's off on its own, right? Medical device manufacturers for a long time have had to think about, what happens to your product out, throughout its life cycle once it's out in the world, how do you take it back? But now it has raised the bar even further. And, I think we
Yeah.
see this a lot too in the industry. There's a lot of consolidation in the medical industry. So you see, medical device manufacturers purchasing another medical device manufacturer, acquiring, merging. So it's then how are you integrating those two things together? How are you making sure that you're understanding a supply chain of a product that you've purchased or a company that you've purchased or someone that you've merged with? So I think it is interesting to see, overall this idea that the bar has been raised in the industry, but for really
Yeah.
great reasons, right? And this idea overall that manufacturers have to just be much more agile with their supply chains and be more prepared, I think is so critical when people are saying, hey, what should we be doing? What can we be thinking about? It's how do you
Yeah.
build that into your processes?
Absolutely. Absolutely.
Yeah. Yeah. So you mentioned it a little bit, obviously, digitization. We talk about that a lot. And of course, the hottest word right now, the biggest buzzword with everything that comes with AI, right? So thinking about AI and digital twins and things that are being used potentially, right, to support some of this traceability and support risk mitigation. Are there things that you're seeing already, things that are reliable, things that are actually working in practice and not just theoretically that people can be using that start to incorporate some of these technologies?
Great question, Clarissa. Look, these technologies, you mentioned AI, you mentioned digital twins, and let's not forget the impact of blockchain also. But these technologies are really unlocking new levels of visibility and control. And let's talk about them one by one. AI today is helping companies have predictive analysis. It is helping them flagging risk before they turn into the real problems, whether it is a production process or it's a supplier delay risk or it's a quality deviation. And at the same time, blockchain, we all know it can create secure, unalterable records for every step in the supply chain, which is a game changer for traceability and fraud prevention. And when we talk about digital twins, I read an article recently. It's revolutionary. It is allowing having real-time simulation of your product as well as your supply networks, and it is helping companies test scenarios and make safer and faster decisions. So all these technologies come with their set of challenges also. And at Intertek, we are supporting clients through our ISO 42001 gap-based gap. So, and ISO 42001 is world's first international standard for AI management system. And Intertek being the world's first, one of the world's first in internationally accredited certification body, we are helping companies with ISO 42001 based gap assessments and certification audits for their AI management systems. So to help them integrate AI into their operations with the right controls for governance and compliance. And then combined with our expanding Intertek AI Square solution suite, we are well positioned to support clients in their technology adoption journey.
Yeah, absolutely. We did a couple podcasts on that. If anyone wants to go back and listen to those, just so many really great solutions that we have around AI, Intertek AI Squared. When we're talking about, the supply chain overall, we're talking about digitization. The world is getting smaller, right? People are really leaning into the, global supplier networks, right? The world is so much smaller than it used to be. So if I'm a manufacturer and I'm worried, right, I'm working through a global network, I'm using lots of different suppliers around the world. How can I ensure their integrity? What can I be doing when I'm dealing with, as you talk about having an agile supply chain, having multiple source partners? So when I'm looking at this from a manufacturer's perspective and I have this large global supplier network, what can I be doing, right, to ensure their integrity when I'm looking at this from across, multiple regions, components from different places, from different sources, from different suppliers?
That's an interesting question. And I can tell you, first of all, we all recognize that global supplier networks are complex and they are high risk, especially when you're sourcing critical components across multiple regions. And you asked me about integrity and how we can ensure that. Like, integrity comes down to more than initial inspections or initial vetting. It's about continuous visibility, performance tracking, and building long-term capability on the ground. I would like to share a case study which we recently published as part of our Supply Tech launch, where we worked on. This is a case study of a global manufacturer having 15 factories in Asia. They wanted to reduce defects and improve cost efficiency. So we prepared a complete program for them, which included tailored assessment program. And also we provided them observatory tools. We gave them training and support for their site staff. And we also implemented a system of unannounced audits. And I can tell you, they loved the entire program and they implemented it in true letter and spirit. Within months, each site reached self-inspection maturity. They were audit ready. It resulted in lower defect rates. And per factory, they managed to save 100,000 USD
Wow.
per site annually. So you can do the maths for 15 sites. That was a massive saving
huge
for them.
Savings.
And it shows us that how proactive supplier engagement, proactive implementation of systems, and having third-party oversight can drive both quality and value, especially in complex, high-volume networks. And if we bring back to your question of sourcing critical components from multiple regions and ensuring the integrity and the compliance is in place, then I would say that again, it's a high-risk process. So supply integrity will depend on more than initial audits and having implemented ongoing validation and performance monitoring. And it's again very easy for industry to find that the value which third-party auditing companies like Intertek bring to the table. We support clients through supplier qualification programs and on-site audits, as well as lab testing of critical materials. And our supplier management solutions help companies standardize their processes, no matter in which market they're operating, in Asia or Europe or Latin or North America. And what we try to communicate and educate to our partners, our customers here, is that integrity is not a one-time check. It is a continuous loop of data, trust, and independent verification.
Yeah, it's so critical, I think, for manufacturers to be thinking about this, right, from that perspective, right? And really,
Yeah.
It can seem overwhelming. I mean, it really can when you're thinking about it, especially when you're thinking about the complexities of some large medical devices and everything that goes into it. But as you break it down piece by piece, and really focus, it can become more manageable than I think at first, of course, it seems, Yeah. Yeah. So, another kind of inline topic, which I know is really important to you, it's definitely one of the foundations at Intertek. It's something that I'm super passionate about, is of course sustainability. And so when we think about, the future of medical devices, we think about supply chains, we think about sustainability and how, from a circular economy standpoint, from, meeting ESG requirements, right? When you think about the role of sustainability in all of this with medical device manufacturers, how does that all, integrate in your mind?
So look, let's start with this famous statement that sustainability is now front and center. And medical device companies are being asked to report on their carbon emissions. They are being forced to reduce their packaging waste, as well as manage their hazardous substances. And manufacturers are under immense pressure to measure and improve their ESG impact and explore circular economy needs. The models like refurbishments or recycling. The challenge is doing all of this without compromising on safety or compliance. And we have so many examples where at Intertek, we have supported the medical device companies through life cycle assessments, through ESG audits, as well as guidance on sustainable procurement. And independent verification is super important in this entire process. It is the key because it brings credibility to sustainability claims and it helps companies meet the growing investor, customer, and regulatory expectations and pressure.
Yeah. And I think, one thing, too, obviously we've participated with a lot of medical device manufacturers, right? It's not just about the safety and the quality. They also have to think about efficacy when you have a medical device, right? Which has allowed in the past for lots of exemptions or lots of ways that medical device manufacturers maybe didn't have to meet certain requirements because of the treatment or because of whatever the product is doing. So I think that's something that's always important to remember too, that, we've been through this process with medical device manufacturers. So we understand it's not just, oh, is the product safe? We understand medical devices also have to be effective, and the choices that you're making, right, all have to play together to say, okay, how can we be more sustainable? How can we think about refurbishing? How can we think about our circular economy? And then at the same time, make sure that we're developing devices that are safe and effective and can be placed on the market.
Yeah. Absolutely right. Yeah.
So before we wrap up here, I know we don't have a crystal ball. We don't know anything about the future. I mean, we never could have predicted, what's been going on over the last 5 to 10 years. But if you think ahead when we're looking at innovations and trends and things that are coming to mind, are there things that you see that will be different about how, I know we touched on a little bit with AI and making things easier from a supply chain perspective, but are there things when you think 5 to 10 years ahead, after 20 years in the industry, right? What do you think is going to be happening in the future for us as we look towards innovations in supply chains?
Yeah. So look, I see 3 major shifts in coming years. I mean, I don't know, it's 5 to 10 years, or it can happen in a couple of years when we see the pace of change these days. So firstly, we will see smarter and more predictive supply chains, of course, powered by AI and real-time data and connected systems. Secondly, the regulatory compliance will go digital. and we will see the impact of cloud platforms, smart documentation, as well as the continuous audit readiness. Thirdly, we will see sustainability will take the center stage, will maintain its center stage, and there will be increase in sustainable design and sustainable sourcing, where life cycle assessment and circular economy principles will become standard practice. But above all, I think trust will remain the currency of global medical device supply chains. And trust will come from transparency. It will come through quality assurance. It will come through ability to adapt without compromising on safety. And Intertek is already working with clients on all these fronts. The future, I clearly see the future belongs to companies that are not only compliant, but also agile, have an element of trust and transparency, and also are purpose driven in how they manage risk and deliver value.
Absolutely couldn't have said it better myself. Samir, thank you so much for joining today. Such a great conversation. If anyone wants to connect with Samir to talk more about supply chains, please feel free to reach out to me. I'm happy to connect you. And if you have any questions or if there's anything else you'd like to see us cover on the podcast, please reach out and let us know. Thanks so much.
Thank you, Clarissa. Thanks for having me. Of course, as we covered today, the medical device industry is at such an exciting crossroads, and I'm looking forward to seeing how we all shape the future together. Thank you.
Yes, thank you.